We are going to discuss 4 types of strokes in this video. Which ones are more common and which ones are more of a concern? However, they are all major concerns, while some pose an immediate risk of death if not treated quickly. But one of the most important things you can do to help prevent strokes is to maintain a healthy lifestyle and healthy blood pressure. Strokes, also known as cerebrovascular accidents or CVA, occur when there is a disruption of blood flow to the brain, leading to damage to brain tissue. There are 2 main types of strokes, ischemic strokes and hemorrhagic strokes. Both types have different causes and symptoms. Ischemic strokes result from a blockage or clot that obstructs blood flow to the brain. The blockage can occur either within a blood vessel supplying the brain by the formation of a blood clot, or the clot carried from another part of the body, such as the heart. The symptoms of an ischemic stroke can include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, difficulty walking, dizziness, and severe headache. Consult your health care professional before making any changes to your medication or lifestyle. Hemorrhagic strokes occur when a blood vessel in the brain ruptures and causes bleeding into or around the brain. This can be due to conditions such as hypertension or high blood pressure, aneurysms, or arteriovenous malformations. That is, abnormal connections between arteries and veins. Symptoms of a hemorrhagic stroke can include sudden severe headache, nausea and vomiting, seizures, weakness or numbness, especially on one side of the body, and altered consciousness. Transient ischemic attack, mini-stroke or TIA. Often referred to as a mini-stroke, a TIA is a temporary disruption of blood flow to the brain. It produces symptoms similar to those of a stroke but typically lasts only a short time, usually minutes to hours, without causing any obvious damage. Wait, there is more. But do not forget to hit the like button and subscribe. Silent strokes, also known as silent cerebral infarctions (SCIs) or silent brain infarcts, are a type of stroke that occurs without noticeable symptoms. But, unlike typical strokes, silent strokes do not cause obvious and immediate symptoms, such as weakness, numbness, or difficulty speaking. Silent strokes may go unnoticed because they occur in regions of the brain that do not control critical functions. Whether they cause long-term effects is still open to question. More recently, researchers have confirmed that having multiple silent strokes puts you at risk for vascular dementia, also known as multi-infarction dementia. Silent strokes are typically discovered incidentally during brain imaging studies, such as MRI magnetic resonance imaging, which may be performed for other reasons. Even though they don't cause obvious symptoms, silent strokes can still lead to damage in the brain and increase the risk of future strokes. They are often associated with small vessel disease and can contribute to cognitive decline over time. Risk factors for silent strokes are similar to those for symptomatic strokes and may include high blood pressure, diabetes, smoking, and other cardiovascular risk factors. Because they don't cause immediate symptoms, individuals may not be aware that they have experienced a silent stroke unless it is detected through medical imaging. It's important for individuals at risk for strokes to manage their risk factors through lifestyle changes and, if necessary, medications prescribed by healthcare professionals. Regular medical check-ups and screenings can help detect silent strokes and other conditions early, allowing for appropriate intervention to prevent further damage and reduce the risk of future strokes. Common risk factors for strokes. High blood pressure, a major risk factor for both types of strokes. Smoking increases the risk of clot formation and atherosclerosis. Diabetes can contribute to blood vessel damage. High cholesterol, elevated levels can lead to atherosclerosis. Age, the risk increases with age. Family history, a history of strokes in the family may increase the risk. Previous stroke or TIA, individuals with a history of stroke or TIA are at higher risk. Prompt medical attention is crucial if someone is experiencing symptoms of a stroke. Immediate intervention can help minimize the damage and improve the chances of recovery. If you suspect someone is having a stroke, remember the acronym FAST. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time to call emergency services. Calling emergency services promptly can make a significant difference in the outcome of a stroke. What types of strokes are more common? So far, if you have learned something, do not forget to hit the like button and subscribe. That way the information goes to more people and may be able to prevent some strokes. Several studies have investigated the prevalence of silent strokes in different populations, and estimates vary. However, a significant proportion of strokes may be silent in the general population. The Cardiovascular Health Study, a prospective cohort study in the United States, reported that around 28% of strokes were clinically recognized, while the remaining 72% were considered silent strokes. In specific populations, studies in older adults have suggested that silent strokes are more prevalent in this age group. For instance, the Rotterdam Scan study found that about 1/3 of individuals aged 60 and older had evidence of silent brain infarcts on MRI. It's important to note that the prevalence of silent strokes can vary based on factors such as age, vascular risk factors, and study methodology. Additionally, advancements in imaging technology and increased awareness may contribute to variations in reported prevalence. The significance of silent strokes lies in their potential impact on cognitive function and the risk of future, more symptomatic strokes. Individuals who experience silent strokes may be at an increased risk of developing cognitive decline and dementia over time. Ischemic strokes are more common than hemorrhagic strokes. Estimates suggest that approximately 85% to 90% of all strokes are ischemic, while the remaining 10% to 15% are hemorrhagic. These percentages may differ based on factors such as age, population demographics, and geographic location. Ischemic strokes are more common and account for the majority of strokes. Hemorrhagic strokes, although less common than ischemic strokes, hemorrhagic strokes are often more severe and have a higher mortality rate. It's important to note that these percentages are general estimates, and the exact distribution may vary based on the specific population being studied. Additionally, advancements in medical imaging and increased awareness of stroke risk factors may influence the observed trends over time. Regardless of the type, both ischemic and hemorrhagic strokes require prompt medical attention. Early intervention is crucial for minimizing damage and improving outcomes. If you suspect someone is having a stroke, remember the acronym FAST. Face drooping. Arm weakness. Speech difficulty. Time to call emergency services, and seek immediate medical assistance. Do not forget to click the like button and subscribe. Thanks very much for watching this video. Up above you see a video related to health. It will be more helpful to you and your family. Subscribe to my channel. See you in the next video.